In this playlist, we'll be discussing about the pathology of esophagus. So this playlist is divided into three parts. The first part is this part, in which we'll be discussing about the esophageal atresia and tracheoesophageal fistula, and also esophageal varices. Then the next video, that is the part 2, will be discussing about eclasia, distal esophageal spasm, and GERD, and also GERD related complications like esophagitis, strictures, and Barrett's esophagus. Whereas in the third part, we'll be discussing about Zenker diverticulum, Mallory-Weiss syndrome, Boerhaave syndrome, Plummer-Vinson syndrome, and esophageal cancer. So let's get started with the first part, that is esophageal atresia and tracheoesophageal fistula. Before moving to the pathology directly, let's first look at the development of esophagus and trachea. So here you can see this is foregut, and during the 4th week there is esophageal ridge developed. There is development of esophageal ridge, and during the early 5th week this ridge grows into a septum, that is tracheoesophageal septum, and this septum divides the esophagus and trachea into two different parts. Here you can see during the late week 5, esophagus and laryngotracheal tube, they are two separate tubes now. But if there is any defect in this developmental process, it can lead to abnormalities like esophageal atresia and tracheoesophageal fistula. Let's compare what's the difference between both of them. So esophageal atresia, it is when the upper esophagus and lower esophagus, they are not connected. Here you can see there is a gap between upper esophagus and lower esophagus, and this is called esophageal atresia. Whereas tracheoesophageal fistula, fistula means abnormal connection. So here there is abnormal connection between esophagus and trachea. So let's discuss them one by one, starting with esophageal atresia. So this esophageal atresia, it is a congenital defect where upper esophagus is not connected to lower esophagus. Clear. And the next thing is, it is usually associated with fistula. It is usually associated with fistula. It can be alone, but most of the time it is associated with fistula, connecting the upper or lower esophageal pouches. Here you can see this is atresia with proximal fistula, whereas it can be atresia with distal fistula, and sometimes there is atresia with dual fistula. Okay, now what is tracheoesophageal fistula? It is also congenital, but it is an abnormal connection between trachea and esophagus, and this abnormal connection can result in aspiration, suffocation, pneumonia, and severe fluid and electrolyte imbalance. Now, this esophageal atresia and tracheoesophageal fistula, they have some clinical manifestations. So let's go through the prenatal ones first. So the prenatal clinical manifestation is polyhydramnios. Polyhydramnios means when the fetus does not swallow enough amount of amniotic fluid. Now the postnatal one. The postnatal one is frothy saliva, inability to swallow, vomiting. Then this is abdominal distension and respiratory distress. Now this esophageal atresia and tracheoesophageal fistula, in both of them, coughing, choking, and cyanosis is commonly seen. But in tracheoesophageal fistula, there is increased risk for aspiration pneumonia. Now, what is the treatment? Treatment can be surgical correction. Now, let's move towards the esophageal varices. What is esophageal varices? Varices means dilated submucosal veins in the lower one-third of esophagus. So, we know, as you can see in this picture, that the lower esophageal veins, they drains into portal vein via the left gastric vein. But when there is portal hypertension, this all the pressure goes into the distal esophageal veins, and because of this there is dilation. Dilation means varices. So it is mostly asymptomatic but with the risk of rupture. If it ruptures, there will be painless hematemesis, and this is the most common cause of death in cirrhosis. Why? Because this esophageal varices, it arises secondary to portal hypertension. And also this esophageal varices, they are one of the most common reason for upper GI bleed. So this was all about the part 1, that is Atresia, Fistula and Varices. I hope you liked the video. If you liked the video, do visit the second part.